Good day, listeners, and welcome to the Breakfast Show on Coal City FM, Radio Nigeria, Enugu. I'm your host, Ekene Odiugwe. As we reflect on World Veterinary Day 2026, today we celebrate the critical role veterinarians play, not just in caring for animals, but in protecting human health, food safety, and our communities at large. This year's theme, Veterinarians, Guardians of Food and Health. Veterinarians, Guardians of Food and Health, reminds us of the work they do and how that work goes far beyond the clinic. It touches every part of our daily lives. One major public health issue where they play a life-saving role is in the fight against rabies, a disease that is preventable yet still claims lives, especially in our communities. Today we are discussing combating rabies, practical steps in protecting our communities. Joining us is an expert in the field, Dr. Eugene Chukwu-Ibe, Chairman of the Association of Private Practicing Veterinary Doctors in Enugu State. Doctor, thank you for joining us.
Thank you, the moderator. Thank you for having me. It's quite a pleasure to be here.
Doctor, to set the stage for our discussion, many people hear about rabies but may not fully understand how serious it is. From a professional perspective, how big of a public health concern is rabies in Nigeria today, and why does it remain a problem despite being preventable?
Yes, rabies has been a big concern in Nigeria and indeed the entire globe, because rabies, it's a disease that has 100% fatality whenever it comes. And what it means is that anyone who contacts rabies, and once the clinical signs start manifesting, there is almost 99.9% chances of the person dying. We've not been able to record successful cure for rabies globally. Even though it has 100%, almost 100% fatality, it also 100% preventable. So it's a big concern globally, because we still have pockets of rabies cases, especially in Asia and Africa, Nigeria inclusive. That means that it's a disease that we have focused our attention to as public health practitioners, as veterinary doctors, and indeed as a country, because even the world itself is hoping that by 2030, we would have been able to eradicate rabies globally. And it is a problem, and it has persisted in Nigeria because of lack of proper awareness. People do not still completely understand the menace of rabies and what to do and how to go about them, especially in the rurals. Then also, we've not been able to galvanize very strong support in terms of preventive measures, especially in mass vaccination across all the states in Nigeria. Until we do that, it still remains a very big public health concern.
Let's talk about what drives the spread. In many of our communities today, stray dogs are common and pet vaccination is often neglected. What would you say are the major factors contributing to the persistence of rabies?
Yes, like you quietly said, stray dogs are still, very predominant in our society. You hear, especially in rural communities, you find dogs moving from one place to another, running into the bushes and coming out, coming back to where humans inhabit, and all sorts of movement of dogs from here and there. You could still say is a major, in fact, it's a red flag. It's a red flag. And the fact that if you get to such rural communities, they do not vaccinate their pets. Even in most of the people who are in the urban communities, they do not vaccinate their pets. What do we mean by this? If we must own pets, especially dog, cats, and few other ones, we must also be responsible pet owners. What do we mean? We mean that you must be able to care for that animal. One, due to animal welfare, you must at least provide a place where the pet will stay, something like a kennel, where the dog will stay, where the cat will stay. You do not allow them to roam around beyond your own confines. Then you pledge and commit to annual or yearly vaccination of these animals, because until they are vaccinated, they may not have the capability and ability. What I mean here is the ability to ward off these diseases when they come, especially now we're talking about rabies. So vaccination is very key because it's a way to prevent. Remember that rabies has 100% fatality when it comes, but at the same time, it is 100% preventable. And one of the major measures of prevention is vaccination.
You mentioned vaccination. This seems to be a key issue. How important is regular dog vaccination in breaking the cycle of rabies transmission?
Yes, I repeat again, regular vaccination is the key to stamping out rabies. What does vaccination do? It actually goes into the system of the animal, this time your dog or your cat, and is able to make them produce antibodies. These antibodies stay and wait for any environmental contamination, or that means any kind of introduction of rabies virus into their system. And once that virus comes in, the antibody mount a protective immunity and is able to handle or dissolve or kill that environmental rabies that just came in. So once you keep your dog in such a state where the system is aware and is ready to fight any external invasion by rabies virus, then your dog stays protected. Now we're talking about dogs. Like I did say at the beginning, that rabies is a disease of all mammals. It means that not only dog can have rabies, even including goat, sheep, cattle. All mammals can have rabies. But you see, the dog-mediated rabies still stands as the highest that transmits to human. Why? Because dogs are almost very close to man. They are the closest to man. We stay with them, we play with them, we have them as pets, have them as security. It's just some say that dogs are a man's best friend. So in that case, having to protect them so that they can also protect us is very key in making sure that we didn't break this cycle of rabies in our society or in our communities. Thank you.
Now, let's move into solutions, because that is where the real impact lies. For the average listener at home, what practical steps can individuals and families take to protect themselves from rabies?
Yes, for families and individuals, or individual and families, it's just simple. The simple thing is that you don't just stay and rabies will meet you. Like I said, most of the human rabies we've had, have encountered, are actually dog-mediated rabies. It came from dog to human. So if we're able to take care of our dogs or our pets, very importantly, if we're able to take care of them by making sure we administer this annual rabies vaccine to prevent them from getting rabies, we may have, solved the problem 80 to 90%. because it's only when the dog has rabies that we are in danger. If the dog doesn't have rabies, we don't have any danger. And remember, dogs don't carry rabies. People have this myth or thinking that every dog has rabies. No, dogs don't have rabies. But like we say, rabies is a disease of all mammal. A dog can acquire rabies. When another dog that has rabies bites, if it's a roaming dog, or because also we have several other ways they can contact it, especially for those who live in the cities, who live in places where the dog stays in a confined within your home. You may be thinking, is that protected? You're not vaccinating because it doesn't go out. No, you know that bat also is a mammal, and bat is the connection between the wild and the urban. A bat flies to the wild in the night, they are nocturnal, and they may also fight with some other vicious animals in the wild who may have rabies, and they'll carry it and they come back to where people live. And so we are emphasizing that whether it's in a confine, that means it stays within your compound, or it goes out, whatever it is, please make sure that your animal, that's your dog this time, or your cat, has that annual vaccination as a way of prevention. Thank you.
If someone is bitten by a dog or any animal, what immediate actions should they take before even getting to the hospital?
All right. When a person is bitten by a dog or any animal for that matter, the first step one takes is to take soap and water. Wash that particular place immediately with soap and water, running water. Wash copiously. Let it lather, let it foam. Wash it up to about 15 minutes, because rabies virus is an envelope virus. It's denatured by detergent, whether soapy or soapless detergent. It denatures it, so it renders the rabies inactive. So if we're able to wash that wound site or that bite site very copiously with water, running water, and then would have reduced the viral load at that point, and would have, possibly stopped the rabies from moving further, because it would have reduced their number. Then immediately after, you can also disinfect that point of bite with substances like povidone iodine. You can use methylated spirit, high concentrated methylated spirit. You can use hydrogen peroxide. And when you do that, if the wound is well open, or if the wound is very obvious, do not stitch, do not cover it. You allow it open and let it drain. But immediately you have to move to the hospital to seek medical attention. You must also report to your closest veterinary center then for further advice. But what we currently ask people to do is that, because of new findings, so now we say every dog bite is considered a potential danger. So in that case, even after doing all the first aid I have talked about, we will advise you to go to the human hospital and take what we call post-exposure prophylaxis. It's a set of human rabies vaccination that will be given to you, so that whatever traces of rabies that is still left, if ever they were there, could be, your body's immune system will be boosted in such a way that it will handle them.
Okay, if you're joining us, this is Breakfast Show on Coal City 92.9 FM, Radio Nigeria Enugu, and we are reflecting on World Veterinary Day 2026. Theme is Veterinarians, Guardians of Food and Health. Topic is combating rabies, practical steps to protect our communities. Our guest is Dr. Eugene Chukwu-Ibe, Chairman, Association of Private Practicing Veterinary Doctors, Enugu State. You can join us online on www.coalcityfm929.net.ng. Back to you, Dr. Chukwibe. Beyond individuals, communities also have a role to play. What can communities and local leaders do collectively to reduce rabies cases?
Yes, beyond the individuals that own these pets and dogs and whatever name we choose to call them, beyond them, communities and community leaders really have roles to play. And you know that in some communities, they have banned roaming dogs, which is very excellent. So that anybody who is going to own a dog in a community will be responsible for that dog. So you get your dog and you provide a place and do not allow the dog to roam. Community leaders have also liaised with veterinary departments in the Ministry of Agriculture or Livestock Development, as the case is currently, to come and do mass vaccinations of dogs and cats in their locale, that's in their community. So community leaders have a lot of role to play. One is to also whip up this education, take it higher, let people know the dangers of rabies and the fact that it can be prevented, and bring in resource persons and also partner veterinary health workers in coming to do annual rabies vaccinations in their community.
We often hear that children are the most vulnerable when it comes to dog bites and rabies exposure. What specific measures can parents and schools take to better protect children?
Yes, children really most of the time are the most vulnerable to this rabies or dog bite, as it is, because being children, sometimes they take adventures and everything is possible for them. And you see that some of the children don't even have fear for these dogs. They go play with them roughly, and even when the dog bites them, they may hide it from their parents. And children who go to school by foot, sometimes in the villages or even in the city, are beaten by roaming or stray dog, and they even hide it from their parents. They don't even tell anybody until when it's too late, and people will now start reporting, or by then say, it was beaten by a dog so time, and he didn't say anything. So parents should be able to educate their children. Please, if you are beaten at any time, do not hide it. Just say it. So the proper thing will be done before it becomes late. So, and also guide them and let them know that you do not play with dogs so roughly, whether it's the one you own or another person. You do not approach a dog that doesn't belong to you. The dog will definitely bite you because he's doing his work. So you have to keep away from dog. The one you own is your pet. Even as your pet, you guide how you play with it. The rabies virus is located in the saliva of dogs, and even sometimes the saliva may be contaminated with rabies virus. In that case, it doesn't necessarily need to be beaten. When that saliva of a rabid dog makes contact with an open wound in someone's body, it may also transmit from that point. So the saliva of a dog is very, very important. We avoid it. Even when it touches us, we wash off immediately. So this wash up with soap and water immediately. This should be told these children, and they should be able to learn and carry it that way. In that way, they will stay safe.
Doctor, let's talk about policy and structure. What role should government and public health authorities play in combating rabies more effectively?
Right. The government government has a lot of role to play. Government is everything. Government drives policies. Yes, these policies should be enunciated in such a way that they help to eradicate this rabies we're talking about. There was a time in the country where the local government councils were very much functional. And being functional, they implement some level of measures to make sure that pets or dogs do not roam. There was a time when if you own a pet, you get a license for that your pet from the local government council, the veterinary office, the local government council. And your pet will wear a kind of collar, and that collar will have a tag, and that tag is the dog's number, such that if you find a dog somewhere and you're able to look at the tag and say it's bearing number 18, for instance, from the record in the local government council, they already know who has dog number 18. We're just using that as an example. And we may have to come back to such, practices. And of course, it's still there. It's just that they've never given flesh to it any longer. It was not just made to help local governments get IGR. It was also made then to be able to help citizens to be responsible pet owners and follow through their obligations as pet owners. So policies are very important, and policies that also, makes that there is annual vaccination of your pets or your dogs, and also, making sure that you keep that dog or your pet in such a condition that makes for responsible ownership. You remember, there was a time in this country where we had sanitary health workers move along with veterinary health workers. They visit homes, they visit places to make sure that your places are kept in good order in terms of neatness, and you do not have overgrown bushes and all of that. And these are actually the works the local government councils should be doing. And also policies that we are enacted that there should be at least 2 veterinary doctors in each local government, such that you have veterinary doctors closer to the people. You may be surprised that in some states of the federation, you don't even have veterinary doctors in the public service, that's in government, that are up to 10 manning the entire state. Then how do you bring veterinary services and veterinary education to the people? And it's very critical, because without this veterinary education and veterinary services, no other person is well trained to be able to handle it except that veterinarian.
And bringing it back to today's theme, veterinarians as guardians of food and health, how are they contributing? How are you contributing to the fight against rabies in practical terms?
Yes, the theme of the World Veterinary Day of 2026, veterinarians as guardians of food and health. We veterinarians are actually contributing the fight against rabies in several ways, not just rabies, fight against several other zoonotic diseases in Nigeria and globally. We are frontliners in public health. We try to prevent these diseases before they get to the human population by stamping them out in the animal population. We not just do that alone. We try also to make sure that if that animal is what we call food animals that human beings can eat as food, we also make sure that what they eat, the food, the meat, the egg, the milk, it's wholesome enough for people to take them. So getting back to the fight against rabies, veterinarians contribute immensely, because we are the ones licensed to handle these vaccines and to administer them in these animals. We are the ones well trained enough to be able to carry through veterinary education in terms of what to do and what not to do. We are the ones who interface with the communities and the people to make sure that they do the right thing in terms of this disease we're talking about, rabies. So if we have enough veterinary hands in the rurals, in the local government, it will really go a long way in making sure that most of these diseases we have, both rabies and some other diseases we call emerging diseases, or diseases that are very zoonotic, not just rabies, that are passed from animals to humans, are well taken care of. So we have our association, the Nigerian Veterinary Medical Association, very dogged. We've been doing everything possible across all states to make sure that our people get awareness about this rabies. We also do pro bono services in terms of carrying these rabies vaccines into the hinterland. We're giving free anti-rabies across board, doing campaigns off and on season. We've been doing a lot. So in practical terms, veterinarians are contributing very immensely to the fight against rabies.
As we wrap up, Doctor, if you had to leave our listener with one strong message about rabies prevention, what would it be?
As my final advice, or a kind of what I should drop for our listener generally, is that rabies, even though it has 100% fatality, that means it can kill whenever it starts without looking back. It's also 100% preventable. You can prevent rabies, it will not even come at all. And you know that the white man says that prevention is a lot better than cure, and even cheaper than cure. Now, I will say that anyone who knows anybody who knows the person who has a pet or a dog around you, tell the person to make sure that he visits the veterinary clinic, whether private or public, where veterinary doctors are, to vaccinate their dog against rabies. And this should be done routinely, annually, every 12 calendar months. The person should go and repeat it so that it can boost the immunity and keep the dog away from rabies, so that we all will not get the rabies. So that is it. That is my parting words. Thank you.
Thank you very much, Dr. Eugene Chukwuibe, Chairman, Association of Private Practicing Veterinary Doctors, Enugu State, for sharing your expertise and shedding light on such an important issue. Dear listener, the message is clear. Rabies is preventable, and together, through awareness, vaccination, and responsible action, we can protect our communities. As we mark World Veterinary Day 2026, let us appreciate and support the work of veterinarians who stand at the front line of both animal and human health. Thank you for listening. Stay safe, stay informed, and remember, prevention starts with you. This has been Breakfast Show on Coal City 929 FM, Radio Nigeria, Enugu. Producer is Jude Obu. Supervisor is General Manager, Coal City 929 FM, Kate Nebo. Zonal Supervisor is the Deputy Director Programs, Radio Nigeria, FRCN, Enugu Zone, Joy Obitilata. Executive Producer is the Zonal Director, FRCN, Enugu Zonal Station, Dr. Ike Chukwueze. My name is Ekene Odigwe. Thank you for listening.